Okay, I've hit the. Hello and welcome to the Women's India Chamber of Commerce and Industry Corporate Talent Council page. I am Shayanti here, leading Corporate Talent Council, WICCI, West Bengal, Kolkata. The mission of Corporate Talent Council, WICCI, is to hone and shape talent of women, to help women find supportive network, to find meaningful and fulfilling careers. We focus on soft skill development and shaping talent. In conversation today with Blossom Kanjilal, a leading persona at Elderly Healthcare Maities, who has been an integral part since inception of Maities. Through this talk, we also wish to impact lives of women who are looking for inspiration. We are broadly going to be understanding what are some of the skill sets that is important for employees serving the elderly healthcare industry. So, about Blossom Kanjilal. Her commitment to social transformation, especially in the space of elder care and women's empowerment, has positioned her as a change maker in India's emerging social entrepreneurship landscape. With a strong background in stakeholder engagement, community mobilization, and women focused initiatives and training, Blossom is bringing about a revolution in elder care industry. An MBA from Symbiosis Institute of Management Studies, Pune, she has 15 plus years of experience in various sectors such as education, HR, and elder care. Blossom's career journey in healthcare industry is an inspiring example of a developing, a flourishing career. She will take us through it all. All right, over to you, Blossom. Welcome and thank you for joining us today.
Thank you, Shanti. Thank you for your kind words and such a nice, warm welcome. Thank you so much. It's truly a pleasure to be a part of WICCI, where a substantial change is coming through and where you guys are making a big difference when it comes to women empowerment. So, to talk a bit about you, already spoken a lot about me. I would now like to little bit talk about how we are bringing about this difference through Maitis.
Right,
So,
right.
you're aware that we are a social startup and we are dedicated to redefining elder care in India.
Yes.
So, Shanti, has it ever been that you have faced a situation where your loved ones, and especially an elderly, has fallen sick at night? There is a medical emergency at home.
Yes, indeed.
Yeah,
Absolutely.
absolutely, all of us have gone through, and we all know the kind of trauma that we go through, the mental stress that we go through when a senior citizen, our loved ones, especially our parents, are living all alone, and there is no trusted, dependable person we can turn on to 24/7. So, this is where Maity's root in empathy and innovation has brought about a change where Maity's is providing a range of physical, emotional, and digital service for our senior citizens. Over the years, Maity's has earned the trust of thousands of senior citizens and their families, and we are becoming a respectable name in elder care industry. So nationwide, elderly population is just growing and it's growing at an unprecedented rate. So the question of affordable, accessible, and dignified elder care is becoming more and more critical. More children are leaving abroad, leaving cities, leaving home for their work, is when they want a trusted service provider for their parents. So at the heart of this challenge lies a very stark reality that quality eldercare service has been limited to privileged few. And this is where our visionary, our founder, leader, Mr. Manoj Maity, is changing the way we look at elder care for once and for all, where we have launched our app. You have pay on demand service. Now, a membership does not have to be an elder care service, which is very heavy on your pocket. It's a financial burden. Neither is it having any barrier of membership that you have to go through to book these services. So, in short, Shanti, this is how we are bringing about the change.
Absolutely, and it sounds very, very innovative. Something which is the need of the hour, and every family out there, that we have, there is definitely a need of the elderly being taken care at the right time and in the right way. And I'm so glad to have got to know about yourselves and Maities, wherein you offer accessible healthcare services for the elderly. So indeed, which brings me to the next question, and I'm very curious to know that apart from the technical know-how that you have as an organization and apart from the medical knowledge that you're having, what are the other skill sets that your frontline team has or they are looking to develop.
Let me ask you, if it comes to someone visiting your parents to say, have a chit chat with them or take them out to an OPD visit, what is the first quality that you would want in a caregiver or a care manager?
Okay, on top of my mind, I would think of three things. One is empathy. Okay, I would think of things like they are able to handle crisis. Okay, and they're
Right.
able to manage the situation. So, and of course, communication. They should have that connect, the empathy, connection, and overall crisis management. So they should be able to
Exactly.
handle